Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
There are so many prescribed medications that can create unwelcomed side effects, including sexual dysfunction. So today, I want to tackle that. I want to talk about how commonly prescribed drugs that many people utilize, such as SSRIs, for example, which are the selective serotonin reuptake inhibitor drugs, commonly prescribed for depression and anxiety, along with many other different reasons as to why people would be prescribed an antidepressant outside of being clinically depressed. This is a really large class of medications that can create sexual dysfunction across the spectrum. And when we think about things like erectile dysfunction in men, when we think about low libido, there are certainly many different ways in which sexual dysfunction can occur. Generally, most people look at the desire aspect. So that's that low libido or the lack of interest. So I want to talk today about a really unique nutrient that has been shown to be quite beneficial when it comes to enhancing overall libido, along with many other really positive benefits. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk about how it is that these medications create these unwelcomed side effects. And you think about the irony in that for someone who has depression, low mood, anxiety, and then they're prescribed a medication, and then one of the most common side effects happens to be sexual dysfunction in the setting of just have no desire. So this is why I wanted to bring this topic up, because oftentimes people are either embarrassed to talk about it or they're just not even aware that their medication is potentially creating this problem. So I want to talk about Maca. And Maca root extract is really very, very unique. This is a Peruvian plant extract that grows really, really high in terms of the altitude. So when we think about things like rhodiola, for example, the adrenal adaptogenic herb that we know grows in very harsh conditions. Well, same thing is true when we look at Maca root extract. So this actually is growing 4,000 meters above sea level in Peru. And we know that these plants, these Maca root plants, have been consumed for their nutritional and medicinal properties in Peru throughout the Andes for centuries now. We also recognize that when it comes to the science behind how the maca root and its active constituents are actually working, it's really quite broad. So this is why I wanted to highlight the maca today, because we now realize that we're not just looking at sexual well-being. We're talking about targeting inflammation. We're talking about GI health, brain health, all across the whole body, how beneficial maca root extract can be. Now, what's really interesting is we can kind of look at it in a sense almost as a superfood, because maca itself, if you were to eat the maca plant, very, very rich in fiber. There's essential amino acids, essential fatty acids, vitamins and minerals. We're talking vitamin C, there's iron, so many wonderful things that are contained within the maca. And one of the more common ways in which the maca has been studied scientifically was solely in that setting of sexual dysfunction. But now, as I mentioned, they've found these neuroprotective effects. They found how it can help to enhance memory. They find it's actually very beneficial for people who are depressed. So remember I said that the antidepressants can create side effects, and they're actually finding that the maca itself can help to support better mood. It's a very powerful antioxidant, and we know it eases inflammation. So across the board, all of these different things. And this is in the Journal of Food Function, where they kind of go through and they're targeting and highlighting all of the different ways in which this really unique plant from Peru is so supportive to so many different human health concerns. Now, when we look at the actual impact that it's having, that we can assess, they have been able to detect how it's working amongst inflammatory markers, how blood pressure is improved when people are utilizing maca. They have looked at hormone levels and how that has improved when people use maca. Been around for a very long time in the Journal of Plants, Foods, and Human Nutrition. They go into the details on that. They were showing that association between those lower levels of things like interleukin 6 and how powerful that maca really is when it comes to enhancing the body's ability to target inflammation, which is why I wanted to talk about a study that showed the power of maca root extract when it comes to the liver. And in this study, they were looking at the anti-inflammatory activity of maca in patients who had hepatitis and the way that it was working, looking at how the maca could actually suppress or inhibit the activation of NF-kappa beta. So we know that that's that master driver for inflammation in the body. So all of the research that they have done up until this point, they've recognized all the different ways in which maca can reduce inflammation in the body, and specifically which different inflammatory cytokines are impacted. So we look at tumor necrosis factor alpha. I had mentioned interleukin 6, but we also see that the way that it is doing this is through the inhibition of NF-kappa beta. So really some powerful research out there. That was in the Mediators of Inflammation journal. But let's go back to what most people think of maca for. So when you think about low libido in the situation with men with erectile dysfunction, for example, we know that maca has been shown time and time again to really help to enhance the libido. And it does this via activation of helping to support better levels of sex hormones. So when we're thinking about estrogen and testosterone, this is why for many people, they used to always say, oh, maca is good for men. But now they're realizing that maca is actually very, very beneficial for women as well. And when you think about the balancing of the neurotransmitters in the brain and managing stress and helping to optimize the different signaling pathways, which are so critical when it comes to hormonal balance, when it comes to mood. This is why they are finding that the maca really does so much when it comes to helping to support women in particular. Now, the way that they have looked at this is that the maca itself is kind of working via three different mechanisms. One is through the HPA axis, so that's the hypothalamus pituitary axis, and then looking at that regulation of the adrenal glands. So I had mentioned rhodiola earlier, the adrenal adaptogenic herb. We are now recognizing that maca as well has this adaptogenic property to it. And then we look at the optimization of the brain neurotransmitters. Hence, this is why the studies are now coming out and saying, hey, maca is not just good for people who have antidepressant-induced low libido. Maca is actually good for people who are depressed, because when they start using the maca, they feel much better. So we know that it's working to support healthy serotonin release and helping to support GABA. So really very powerful information that we now know. And it makes sense. It's like, well, no wonder why in Peru that they kind of turned to maca for this kind of cure-all for so many different things. Someone has inflammation in the body. Maybe they have a problem with their knee and they start to use the maca. They're finding, oh, hey, I have less inflammation. When we look at GI issues, taking the maca, maybe easing inflammation within the gut, so helping to support the microbial environment. Now, when we look at particular studies with women in particular, we'll just say, because we know that the studies with men and maca have been shown time and time again to be very beneficial to help to enhance or increase libido. But I want to talk about in postmenopausal women. There was a study that was done where they were giving women, this was a double-blind placebo-controlled trial, but they were giving women roughly about 600 milligrams of maca every day. And then they were assessing them over time to see if there was any improvement in terms of their sexual dysfunction that they were experiencing. And in just 6 weeks, the women who were given the maca extract saw a over 30% increase in improvement on those rating scales. So we're talking about looking at anxiety, depression, sexual dysfunction, just 6 weeks of them taking maca, and they have the significant improvement. Now, that's a really positive thing because for many women who go in and say, I don't have, much of a sex drive, have no desire, their doctor says, well, maybe you're depressed, let's put you on an antidepressant, and then it just makes the low libido even worse. So this is why I wanted to bring this up. And we've seen the studies. I mean, we certainly know when it comes to sexual dysfunction, this is really common. About 40% of women and probably roughly 40% of men have some form of sexual dysfunction. So trying to really determine what the causal reason for that is. Is it a physiological issue? Is it a side effect from a medication? Is it the hormonal imbalances? So we're looking at the endocrine issue. But we know that that's a really large number. So if you have over 40% of women who state that they have this and, over 30% of men, then we know that this is a problem that certainly needs to be addressed and targeted because this is an area where emotional well-being is very, very important. And to overlook things such as, hey, I'm on an antidepressant, now I have the side effect, and to just kind of sweep that under the rug as that being normal, no, we shouldn't accept that. This is why they're now doing these studies and looking specifically at the impact of SSRIs. So when we think about Prozac, Zoloft, all of those different medications, we know are very common to cause this. We also know that beta blocker drugs, the diuretic drugs can do this. There's so many different classes of drugs that can create sexual dysfunction in both men and women. So let's look at this study. And this was in the CNS Neuroscience Therapeutics Journal. And they were looking at whether maca, this Peruvian plant, would be effective for SSRI induced sexual dysfunction. So there was even a name for it, SSRI induced sexual dysfunction. So they conducted a double-blind randomized placebo-controlled trial. And they were giving these women who have been on SSRI, who are complaining of sexual dysfunction, they gave them either a placebo or they gave them maca root extract. And they wanted to assess if there was any improvement. And they found that not only was the maca very well tolerated by these women, so no side effects, nothing like that, but they said it was actually alleviating the SSRI-induced sexual dysfunction. And so they said, indeed, this has a really beneficial effect on libido. And so then they noticed that the women had better mood. So they're saying, okay, well, is this because of the sexual dysfunction is gone? Or is the maca doing something? And sure enough, it's the maca. When we think about the neuroinflammation and the oxidative stress and the support of the release of those neurotransmitters, they actually realize that, hey, the maca is really working to help stabilize mood as well. So just impressive studies that are out there. There's another one where they were looking once again at a treatment for women who were experiencing antidepressant-induced sexual dysfunction. And in this study, similar type of a setup, they actually broke it into two different groups. They had pre-menopausal women and postmenopausal women, because remember, sometimes women postmenopausally, they go in to see their doctor, say, I have no libido, and their doctor says, yeah, but that's normal. Or here, take this antidepressant. So they said, well, let's, try and take that bias out. So we'll take premenopausal women and postmenopausal women, and let's give them Maca. Now, these are all women who are on antidepressants, who are experiencing sexual dysfunction because of their antidepressant therapy. 12-week study of giving them Maca. Now, this was a double-blind placebo-controlled trial once again. So some of the premenopausal women were given a placebo, some given Maca. Same thing with your postmenopausal women. Some were given placebo, some were given the Maca. And they found that in both groups, that the Maca root extract was able to alleviate the SSRI-induced sexual dysfunction. That is impressive stuff. We know so much more now about this really unique Peruvian plant. We see how it's working in the body. We understand now why, when we think about energy, Maca can be beneficial for that, because now we're thinking of the adrenals. We understand how, when we think about anxiety and depression, once again, that HPA axis, we're targeting the adrenals, we're supporting proper neurotransmitter release. And at the same time, we're helping to enhance the normal sex hormones that are being produced. So it's incredibly powerful. And for many people, maybe they've heard of it, they're not exactly sure what it's utilized for. But we do know that at the end of the day, this is something that is found in nature, has been shown in clinical trial after clinical trial to do all of these really amazing things. I mean, there's studies where they have looked at how Maca root extract can actually be beneficial when it comes to optimizing healthy weight. So when we think about this and we say, okay, well, maybe I should be utilizing Maca. Maybe my issue doesn't have anything to do with sexual dysfunction, but maybe I do on occasion have a little bit of low mood or anxiety, or maybe I have concerns about liver health, in terms of non-alcoholic fatty liver disease. Or maybe I just want to take this really unique plant-based nutrient that's been around for so long, that grows in this very unique environment and provides so many powerful nutrients within it, the antioxidants, the vitamins, the minerals, those essential fatty acids, so many things that are contained within the maca itself that really help to optimize our overall health and wellness. So that's a little bit about maca for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram, and we will see you next time for another episode of the Invite Health podcast.